Yeah, thank you. So this is the management of neglected tropical diseases by myself. Next slide. I'm in the Department of Biological Sciences, School of Pure and Applied Sciences in the University of Embu as a senior faculty in the department. Next slide, please. So what is really tying us together in this particular webinar, and which have come out clearly from the area speakers, is that we have the One Health approach, and it has been gaining popularity over the years. And this is where we are actually having the fact that human health is related to health of animals and our environment. Just the concluded presentation, we had the presentation on the schistosomiasis, and we saw how integrated the disease transmission is, considering the environmental factors and also the animals which are acting as reservoirs. So I think this is one of the key approach that we are not going to lose in the future. So it will continue being operational for as long as I can see for foreseeable future. Next slide, please. So with the integrated management, and why I was passionate about this overview is because when mainly we are talking about neglected diseases, number one, they are also neglected by the communities where they are endemic. For example, we have just been told that one patient decided that, well, even though there is the availability of drugs during mass drug administration, there is no need for him to actually take the medication. Why? Because he thinks that the infection will occur. My experience is that, in fact, in areas where schistosomiasis is endemic in Kenya, and especially hematobium, where you find that one of the symptoms is blood in urine, you find that the person who is not having blood in the urine is the one who is considered abnormal. So it is as bad as that, where you find that neglected diseases are actually neglected by the patients themselves. And this can actually be anchored on a theory of liaison action. Probably they are not causing as many deaths, and the impairment is over a period of time. However, the morbidity is severe, and we have actually laid ground that actually a mortality can also result from these infections, and it does result from these particular infections. And again, you also find that women and children are more prone to these particular infections, especially these children who are school age. They have just come from under 5, which is mainly given a lot of attention in overcoming the mortality. But as now the child grows and they are sent to school, the attention reduces a bit, and even on the health consecutively, considering that it is imagined that the immune system have been strengthened over time. Now, for the integrated management, it is very important because of the complex life cycles. If we are doing chemoprophylaxis, chemotherapy, then where we have the vectors, we also need to target the vectors. Where we have the intermediate hosts, we also need to target the intermediate hosts and the reservoirs, which definitely become the continued source of infection. Now, with that in mind is definitely elimination. The intermediate host, all of them at the same time. However, if we are able to eliminate the parasite, I think that is usually the main target, but the vector is also a focus for many integrated management. And now what I can say is that over the years, including here in Kenya, we have had very successful gains, meaning that morbidity and mortality have been reduced. In general, the burden of disease associated with neglected diseases have down. However, challenges still facing these have been highlighted by various other impediments, and probably we will be asking ourselves if we lost these gains during the pandemic era. But I saw in Philippines there were mechanisms, and I believe in other parts of the world we still had mechanisms put in place to tackle these infections in tandem with the control measures that were there for the COVID-19 pandemic. Next slide, please. So integrated management is the second pillar for WHO to control, eliminate, and eradicate. And from where I sit, I think these have been, in Kenya particularly, we have had a success story, especially elimination of tuberculosis, which have been declared eliminated for some years now. And we are hoping that it will be declared eradicated after the duration that is put without any new incidents, which will be very good news for last year. So all these are geared towards adding the entities by 2030. Are we on track? That is a question we should ask ourselves. Are we on track to eliminate the entities by 2030? And we can only be able to do that with tracking the progress over the years. Next slide, please. So with the management of entities then, and the challenges that have been highlighted, I had reflective questions in mind. And what I was asking myself is, what were the effects of COVID-19 pandemic on the management of entities? Did we lose all the gains that we had made? And what really can we do to fast track ourselves for this particular goal of adding entities by 2030? For the classic example that we have here in malaria infection, which actually is an